I'm joined here today with Dr. Leslie Appiah, who sees patients at CU Medicine Gynecology, Cherry Creek. Dr. Appiah is the medical director of the Fertility, Preservation, and Reproductive Late Effects program at the University of Colorado. Today, we're talking about cancer survivorship and the potential reproductive late effects that can happen due to these cancer therapies. To start, Dr. Appiah, what does the term reproductive late effects in cancer survivorship mean exactly?
Reproductive late effects refers to the gynecologic and urologic adverse effects that occur after cancer treatments. So different cancer treatments can affect our reproductive tract differently. For example, pelvic radiation can affect a woman's ability to have intercourse, can cause scarring of the vagina, can cause injury to the uterus that predisposes to poor pregnancy outcomes, so miscarriage, low birth weight infants. Chemotherapy can affect the way the ovaries function, which can place a woman into a premature menopause with all of the consequences of that, right? So early osteoporosis, hot flashes, night sweats, joint pain, mood disorders, all of those conditions.
And so not all cancer treatments are created equal. Which cancer treatments can affect a person's fertility?
So there are chemotherapies and then radiation therapies. And within the chemotherapy arm, there are different types. So some chemotherapeutic agents don't cause harm to fertility. They don't cause harm to any of the reproductive organs, and then others do. So the category of chemotherapeutic agents that are most harmful to women are alkylating agents. So those are things such as cyclophosphamide, which is a chemotherapeutic agent that's been around for many, many decades and is extremely effective in curing cancers or being part of the regimen to cure cancers, but can be harmful to normal tissues as well. So hair, skin, and then ovaries and testes as well. There are other agents that are not as concerning. And so part of our role as the fertility preservation team is to identify which agents are most harmful so that patients have a good understanding of whether or not they are at risk. If they are at risk, we want them to know. And then radiation. So total body irradiation that occurs prior to stem cell transplant or bone marrow transplant, or that occurs part of that treatment. And then pelvic radiation, where there is direct radiation to the uterus and the ovaries or the testes that can cause infertility. In addition, patients who receive radiation to the brain, those organs stimulate the ovaries and the testes to produce hormones and to allow for sperm and egg production. And when the organs in the brain are damaged that produce those hormones, then patients can experience infertility as well. So many organs within the body can be affected by radiation and chemotherapy, and that can cause problems with fertility.
Thank you. What would you say to someone who is currently on or about to embark on a cancer journey?
Absolutely. So any patient who has a cancer diagnosis or there is a concern for a cancer diagnosis should ask their oncologist to provide a consultation with a fertility preservation specialist. Not every institution has such a specialist, but there is a growing network that patients who at their home institution may not have that expertise can be seen by individuals in surrounding states or surrounding cities. So we don't want the onus to be on the patient, right? We want our oncology providers to know that there is potential harm and to offer a referral to our patient population. However, it's always important that both sides are educated and aware. So we want our patients to know that there are options to preserve fertility prior to cancer treatment, and that there are considerations that need to be thought about as relates to their overall gynecologic health and sexual health, urologic health.